When you're a community nurse, it's about more than nursing, it's about creating bonds.
She gave me a pewter pin that said "Nurses are angels," with a big pair of wings on it, and I treasure that pin. I just treasure it, and I miss her every day.
You're getting to work one-on-one with the clients and hopefully getting them to the point where you're giving them back their independence.
It's a job they love and now a job they are fighting for. Nurses and administrative staff employed by the for-profit company Carepartners have been on strike since April 10th. After more than 15 weeks on the picket line, the strike is taking a toll on workers and their families.
I had a birthday party that I wasn't going to be able to put on for my daughter, and I had some great friends pull through, and I had someone make a cake for me and lend me the things that I needed for the party, so that was fantastic.
And it's a toll on patients too. One woman who doesn't have the ability to speak expressed her concerns through a letter to workers and media, calling the nurses' working conditions appalling and comparing their compensation to that of dog walkers. And that is why they're fighting.
We're working without a collective agreement entirely. I mean, we don't have our first collective agreement, and that makes for really poor working conditions, and our patients are suffering.
They get one flat rate. For the starting RPN, that's $16 and change. So if they're there for 2 hours, they're making far less than minimum wage. On top of that, then they go home and they need to do their paperwork.
You do the math. Take a VON nurse, for instance. They get paid by the hour, paid sick days, and can bill for travel and administrative time. These workers are paid per visit, not by the hour, have no sick days, and no compensation for overtime. And they do the same job.
Every dollar that goes in there should be put in right into frontline services. And again, it's not greedy, it's not unreasonable for a union or a worker to say, listen, I want to be fairly compensated. I want just the industry standards.
An industry that Carepartners owner Linda Knight should know well. She was a nurse and created Carepartners to help others.
I would remind her of the speeches she used to give when she used to come down here and see us and tell us all about what this what Carepartners was all about.
Oh, I'm very disappointed in how you're treating us. You know, you're a nurse, you're supposed to have compassion. We aren't asking for the world.
Now this fight has become something more. It's about the big picture and fighting for healthcare as a whole.
Here you got somebody taking their tax dollars that's supposed to provide services, right? And that's actually cutting back on the workers, cutting back on the services, and putting more money in their pockets.
The only goal now is to get back to the bargaining table so that these employees can get back to work.
I really would love to get back to work because it's what I do. I'm a nurse at heart. It's in my blood. I miss my patients. I've heard from some of them. I know they miss me.
There is some optimism that these nurses and administrative staff will get what they deserve. In the meantime, OPSEU is urging the public to join the fight by calling the Minister of Health and Long-Term Care at 416-656-0943 or email ehoskins.mpp.co@liberal.ola.org. After all, it's about putting patients before profits.